The concept of brain insulin resistance represents a critical link connecting peripheral metabolic dysfunction to cognitive impairment, revealing mechanisms through which dietary patterns influence neurological health in ways extending far beyond simple energy provision. This emerging understanding transforms how researchers conceptualize dementia prevention. Insulin functions not merely as a metabolic hormone regulating glucose uptake, but serves crucial roles in brain signaling affecting memory, learning, and overall cognitive function. Neurons, particularly in the hippocampus and frontal cortex, regions essential for memory formation and executive function, express insulin receptors that respond to insulin crossing the blood-brain barrier. Insulin binding to these receptors triggers intracellular cascades affecting synaptic plasticity, neurotransmitter receptor trafficking, and tau protein phosphorylation, with all these processes fundamentally important for normal cognitive function. When peripheral insulin resistance develops through chronic high-sugar diets, obesity, and sedentary lifestyles, multiple consequences affect brain insulin signaling. First, peripheral hyperinsulinemia, elevated blood insulin levels compensating for insulin resistance, triggers downregulation of insulin transport across the blood-brain barrier, reducing brain insulin availability. Second, chronic inflammation associated with metabolic syndrome produces cytokines that directly impair insulin receptor signaling in neurons. Third, competition between insulin and amyloid beta for degrading enzymes may allow toxic amyloid accumulation when insulin levels are chronically elevated. The clinical manifestations appear in research linking insulin resistance to cognitive impairment. Longitudinal studies demonstrate that individuals with metabolic syndrome, characterized by insulin resistance, abdominal obesity, and dyslipidemia, face approximately 60% increased dementia risk compared to metabolically healthy individuals. Cognitive testing reveals that insulin-resistant individuals perform worse on memory tasks and executive function assessments years before any clinical dementia diagnosis, suggesting that cognitive effects begin early in the metabolic disease process. Neuroimaging provides visual evidence of these effects. PET scanning using radioligands that detect insulin receptor availability shows reduced receptor expression in brains of insulin-resistant individuals. Functional MRI studies demonstrate altered patterns of brain activation during memory tasks in people with metabolic syndrome compared to healthy controls. Furthermore, some studies directly linking brain insulin resistance to amyloid and tau accumulation suggest that metabolic dysfunction may accelerate the pathological processes underlying Alzheimer's disease. The therapeutic implications generate optimism. Unlike genetic risk factors for dementia, which remain beyond current modification, insulin sensitivity responds to dietary and lifestyle interventions. Studies demonstrate that reducing added sugar intake, particularly from beverages producing the most dramatic glycemic excursions, improves insulin sensitivity within weeks. Exercise enhances insulin receptor signaling through multiple mechanisms, including increased receptor expression and improved intracellular signaling cascades. Weight loss among overweight individuals consistently improves insulin sensitivity and reduces inflammatory markers. The intervention timing question remains incompletely answered. Animal studies suggest that early life metabolic interventions preserve cognitive function most effectively, while late life interventions show diminished benefits once substantial neuronal damage has occurred. However, human studies indicate that metabolic improvements even in middle age and early older adulthood can slow cognitive decline, suggesting that the window for beneficial intervention remains open across much of the lifespan. The nasal insulin research offers fascinating possibilities. Some studies have administered insulin directly via nasal spray, allowing it to reach the brain while bypassing peripheral effects. Results show improved memory performance and glucose metabolism in brain regions critical for cognition. While not yet approved for cognitive indication and requiring further study, This approach demonstrates that enhancing brain insulin signaling directly improves cognitive function, supporting the mechanistic framework connecting brain insulin to cognition. Warning: the brain insulin resistance framework should not oversimplify dementia causation or create false assurances that dietary changes alone prevent dementia. Alzheimer's disease and other dementias involve complex interactions among genetic susceptibility, protein misfolding cascades, inflammatory processes, vascular factors, and potentially infectious agents. Metabolic dysfunction represents one contributor among many. However, its modifiable nature makes it a rational and important intervention target. Individuals should understand that optimizing metabolic health through dietary changes, including sugar reduction, constitutes prudent risk reduction, but does not guarantee dementia prevention, particularly in those with strong genetic risk factors.